Does a vacuum erection device increase girth or length? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm going to be talking all about vacuum erection devices and if they actually change the length or girth of your penis. Now, what exactly is a vacuum erection device? I've talked about these in detail in a couple prior videos, but essentially it's comprised of a cylinder which causes negative pressure on the penis that then leads to increased arterial blood flow in the corpora cavernosa, or the spongy erectile tissue of the penis. This is then combined with a constriction band that is put at the base of the penis after you get the erection, and this reduces outflow so the blood does not leave the spongy tissue and cause flaccidity. Now, there's some hypotheses that vacuum erection devices might actually increase nitric oxide release, and which is essentially the ignition for erections, causing smooth muscle relaxation. Now, the best benefit of a vacuum erection device is that you can have multiple erections using a vacuum erection device, and you don't need intact nerves, which is something you need with many of the other treatments that are there for erectile function, particularly like medications or injections. You need the nerves to be working well, and the vacuum erection device allows you to still have erections even if your nerves are not optimal. Now, when thinking about length and girth, the data on vacuum devices is often done for men who have radical prostatectomy. That's where they're doing the research on, because these men are often undergoing something called penile rehabilitation. And the thought is that when you use a vacuum device after prostatectomy, you can increase oxygenated blood flow to the corpora cavernosa, or the erectile tissue, and that may activate some processes that can prevent the cells from dying or fibrosing, which is scar tissue, and preserve some of the normal mechanisms of the veins and arteries so that they do tend to function appropriately. So let's go into the data. There's been a couple small studies looking at vacuum erection devices. One was observational study looking at 74 men over 52 weeks, so a year, who used vacuum erection devices 5 minutes twice a day for 12 weeks. And so after radical prostatectomy, men tend to have penile length loss. On average, men can lose anywhere from 0.5 centimeter to 4 centimeters in length after radical prostatectomy. However, now with robotic techniques, that length loss is significantly less. But again, people still want to preserve their penile length. So they've looked at, does using the vacuum erection device after prostatectomy preserve length? Another study looked at men who had nerve-sparing prostatectomy, and they used a vacuum erection device 5 minutes every other day for at least 9 months after surgery. They noticed that only 23% had a decrease in length and girth compared to 63% of men who did nothing after prostatectomy. Another study looked at 42 men who used a vacuum erection device more than 50% of the time, and only one had a decrease in their stretched penile length. So at least in the prostatectomy literature, many studies showing that it will preserve length. Meaning, is it increasing length? Maybe, but at least it's preserving the length that they had prior to surgery. The other way we've looked at vacuum erection devices is prior to getting penile implants. If you want to learn about penile implants, I've made a few videos about them, but essentially they are surgical treatments for erectile dysfunction. So when you've tried everything else for erectile dysfunction and nothing seems to be working, then you can get a penile implant, which allows you to get an erection on demand with a pump device that's in the scrotum. When people get penile implants, a lot of them will perceive that they're losing penile length. And that's because the penile implant doesn't expand in the head or the glands of the penis. And so ideally, in those patients, we would love to have a way where we can increase penile length prior to getting the penile implant so they get the largest implant possible. One study looked at a vacuum erection device in men undergoing prosthesis, and they were randomized. So 51 men used a vacuum erection device for 1 to 2 months daily for 10 to 15 minutes. So in this study, they measured the stretched penile length before they started using the vacuum erection device and immediately after using the vacuum erection device for the period of time that was recommended. And they found that these guys gained about 0.8 centimeters in stretch penile length. So less than a centimeter, but certainly did gain some length. So in another observational study looking at 74 men over 52 weeks or 1 year who used a vacuum erection device 5 minutes twice a day for 12 weeks, they noticed that they had an increase in stretch penile length of about 0.5 centimeter and an increase in girth by about 1 centimeter. What about in normal people, right? These are all people who've had surgery for prostatectomy and are going to get an implant, so already have ED. So in a 2006 study, they took 37 sexually active men who had a stretched penile length of 10 centimeters or less. They asked them to do vacuum erection device treatments 3 times a week for 20 minutes on each occasion for 6 months. Here, they did see a slight increase, but it was not statistically significant, meaning that the increase could have been due to chance. It didn't look at girth, it only looked at length. So what do I take away from all this? Well, ultimately, you may get a small increase, but likely, and it needs to be consistent use, and it will likely be transient, meaning that once you stop doing the activity, it's going to go away. Who cares about me? I'm just one person, right? So there's recently been a guideline that was published by the European Association of Urology, and it's called the Guideline on Penile Size Abnormalities and Dysmorphophobia. And this is particularly for men who have things like congenital problems like micropenis, which I've talked about previously on my video about scientifically proven ways to increase penile length, which you can check out, or men who've had penile shortening due to radical prostatectomy or buried penis, which also I've talked about in a prior video. So these are all guys who want to have a longer penis because they have real problems that are causing them to have a short penis or a perceived short penis, and they want to be able to have a longer penis or preserve their penile length. In this guideline, they don't even mention the use of vacuum erection device for girth. However, they do mention it for penile elongation. And word for word, what they say is data on the use of vacuum erection devices for penile elongation are scarce. And in one study of 27 men whose stretched penile length was less than 10 centimeters, use of a vacuum erection device for 6 months did not result in significant increase in stretched penile length or flaccid length. In another 2022 paper published in the International Journal of Impotence Research, they said that given the paucity of data, no evidence is available to confirm the real benefit of vacuum therapy for aesthetic penile improvement. Bottom line, what do I think? I think vacuum erection devices are great for erectile dysfunction, and they may even be great for men who are trying to preserve their penile length after radical prostatectomy. So I think they have a place and a use, but based on the data we have, they're likely not going to increase your length or girth to any really significant amount. Now, people may say they have different results, and that's fine. I think if it worked for them, that's wonderful. But I'm telling you what I know based on the data that we have from these really, really small studies. And to be quite honest, I don't think we're going to see a lot of more investigation in this area in terms of looking at the true benefit of vacuum erection devices. And so ultimately, there could be a benefit that we're just not seeing in the literature because it's not well studied. However, I would caution you if someone is saying that there's this guaranteed length and girth improvement, that I would essentially be wary of that. Anything you use for improving length or girth, like a traction device, it may work, but it's going to be transient. In terms of things that may increase penile length, there's reasonable data now on traction devices and new data on penile Botox that could be beneficial in improving penile length and erectile function. So if you're interested in learning about that, check out my video on penile Botox, or you can see me as a patient in Irvine or Beverly Hills, California, if you'd like to try it. And as always, remember to take care of yourself because you're worth it.